Hello and welcome back to the third day of our See Arthritis event. We are very lucky to have Dr. Lori Tucker joining us here. Thank you so much for coming in today.
Oh, you're welcome. It's a delight to be here.
Wonderful. So we would like it if you could tell us a bit about yourself, how you're involved in rheumatology.
So I'm a pediatric rheumatologist and a clinical professor in pediatrics at the BC Children's Hospital and University of British Columbia.
Mm-hmm. Right. And so you are presenting a session here at the conference on models of care in pediatric rheumatology. Can you speak about that presentation?
Sure. Well, first I want to say I'm not an expert in models of care. So why did I decide to do this sort of session? Because there's a lot of discussion about models of care, which really relates to how we organize our care for patients. Most of that is in the realm of adult rheumatology. So models are developed, and then I see that people are applying them to pediatric rheumatology. And I felt like, well, maybe we should have some discussion around that. Are they really applicable? Are there aspects of care for children with arthritis and families that aren't really being considered? So what we did in the session was we had a little bit of background information explaining, like, what is a model of care? We had experts in Canada who have developed a model of care for inflammatory arthritis from the Arthritis Alliance come and talk to us about how they developed that.
Right.
And then there's a pediatric rheumatologist in Toronto, Dr. Deborah Levy. She talked about some work that we're doing together as a national group to survey all of the pediatric rheumatology teams to find out how do we practice, because we can't really talk about making best practices or sharing practices or what should be done if we don't really know what's happening in Halifax, in Newfoundland.
Right. So across Canada.
Across Canada. Yeah. So she and a graduate student have done a survey, and she presented some preliminary data, which was super interesting. And then we had some brainstorming and had people talk about what barriers there are to providing care and thinking about moving forward, like what would be things we could do, should do in the future. So we didn't come up with any answers, but I think we put together, I think the outcomes really were we put together some information. So I think there was information about where we are now. I felt like there was some interest in thinking about having maybe best practices or shared best practices. And I thought it was very interesting. I thought it'd be really interesting to put some really big picture ideas out there. What's going to happen in 2030? You know, how are we going to communicate with kids, parents? How are we going to do things in a different way? So I think we'll feed back all the information to our pediatric committee at the CRA and continue to work on this.
Well, that sounds great. I mean, of course, models of care should be, relevant and meaningful to each population that they intend to serve. So I'd be interested to know I know it's still these sort of preliminary phases in developing these sort of bigger models of care for pediatrics, but what differences do you see between those models of care for adults and for children? Like, sort of what inspired you to think, okay, maybe things need to be a bit different?
Because in the adult models of care, there's a concept that the patient, first of all, there's a patient self-management kind of aspect of the models of care that goes through the whole model of care. And that presumes that the patient themselves, that might be me, has self-agency, and I seek out the information, and I go and I do. But that's really not relevant to a parent of a 4-year-old or a teenager who's 12. So I think that aspect is very different. The concept of the patient entering the system, the access barriers are very, very different. And part of the reason is we have a real problem with recognition of arthritis amongst primary health care providers. So that might be an area where we could make some improvements or think of ways to improve that. But that's a bigger barrier. And in areas where they have centralized triage systems for adults with arthritis, that just does not work for pediatric rheumatology.
Right.
We don't even work in that system. We're not, most pediatric rheumatologists are not private practice in a community. So that's a system that doesn't really function well for us.
Right. And is that, it's because most pediatric rheumatologists are hospital-based, is that correct?
Most, but it's interesting. That was part of the kind of fact-finding mission we went into, is that probably 85 to 90% of pediatric rheumatologists are in an academic setting. But now there are some community-based pediatric rheumatologists, and in the Greater Toronto area, one in Vancouver, one in Calgary. So working out, that's why I'm looking forward, working out like how did they work with the tertiary care system? How is that going to function to improve care would be a really interesting and important aspect of models of care to work on.
Yeah, absolutely. So thinking about that sort of moving forward, what opportunities do you see in pediatric rheumatology? Where do you hope the field to be in the coming years?
Oh, wow.
Big question.
Yeah, that's a big question. And I think there's a lot of, I think there are many things that hopefully will be strengthened and remain the same. The concept of having multidisciplinary care, where families get all the care they need in one setting, the support that they need in one setting is really important. Are we going to have lots of different kinds of drugs? We'll probably have different kinds of medications. Will we have different ways of diagnosing, not just arthritis, but I'm thinking other rheumatic diseases. We might have different ways of diagnosing things. Are we going to communicate with families differently? We might communicate with families differently. We might be using online resources or different kinds of portals and networks. And I think there are some things already starting that will really strengthen parents' sense of community and belonging and support.
Right, which is so important to not feel like you're alone as a parent or as a child. And I think that transitions very well into maybe talking about CASSEON Friends in your role as a board member.
Yeah, so as a pediatric rheumatologist in Vancouver, when CASSEON Friends got started by a family who had a patient in our clinic with juvenile arthritis. And they saw there was a gap in really just having a community for parents of kids with all rheumatic diseases to come to and just feel support and get information. And so at the time, I think the guiding principles that really differentiate this organization and that group are that CASSEON Friends works together hand in hand with the clinical teams. So they look to us to find out what we think maybe should be, our needs, and we look to them to find out what we need to be doing better. So there's always been this very synergistic, close relationship. Why is that important? It's because I think there's some new concept that they put on the slides, stronger together.
Right.
So parents and patients often say that, but quite honestly, you're not going to be stronger together unless your clinical team is together too, and then we are a power.
Yeah.
So what I've seen over the years is that now CASSEON Friends, we've developed some major, really crazy goals. So, we've, over 2019, I think, with hard numbers, we've touched 641 kids' lives.
Wow. And their families.
And their families and their extenders. In 2023, I think, we're heading for 10,000 lives.
Wow.
And we started out just in BC, and now there are 8 centers up and running across the country, because parents are saying, we need these things. We need these family days. We need ways of communicating. And so I think that it's really a novel way of bringing care providers and patients together
Yeah, absolutely. I mean, we've heard from folks just how impactful it has been on their lives, and it's a wonderful organization, and to be working so closely with clinicians and just making sure everybody is involved is really wonderful. So it sounds like there is lots to look forward to in pediatric rheumatology. What I would be interested in now maybe knowing is, for the time being, things that we haven't already covered, what are the main challenges that exist?
Yeah, so I think, I still think that one of our main challenges is general knowledge of childhood rheumatic diseases.
Right.
And I'll give you an example, right? And because this happens in every pediatric rheumatology clinic across Canada, really quite regularly. A child is referred to us with joint pain, and they come to see us in the clinic, and we find out that that child has actually had joint pain for a number of years, maybe a year, and this happened just last week, about a year, has become increasingly stiff, having trouble doing things at school. And they're not neglectful families. They've been to their family doctor, they've been to an emergency room twice, they've been to a walk-in, they then were referred to orthopedics in a community twice, and it was only after a year that this patient was referred to us, and they have obvious juvenile arthritis in multiple joints, and it's really pretty heartbreaking.
Of course.
Because it's unnecessary, and that can, we should be able to identify arthritis earlier. Absolutely. And understand, it really comes from just a general lack of understanding that this could happen to a child.
Yeah, absolutely. And I mean, that first, sorry, go ahead.
Yeah, so that's something that can be fixed, hopefully.
Yeah, no, of course. And I mean, that first year is so critical for any rheumatic disease to get things under control, and making it that much more important.
Yeah, and it's heartbreaking if families come to see us and we have to say that your child already has damage in their joints because they weren't treated. So I'm going to say actually a big thanks to your organization, because I think it's really through partnerships with groups like that bring information to the public that we get these kind of messages out. So that's, I think that's a big barrier, and we do talk about that amongst ourselves. How are we going to educate medical students, family doctors, government?
Yeah, all the players in it are all important. They all play a part. Yeah, well, thank you so much for talking with us today. We're going to turn to Anita and see if there are any questions from our viewers.
Do you have any self-management tips for children living with arthritis?
Or for their parents?
For their parents. Okay, so if you're a teenager or your child's a teenager, what I would recommend is there's a fantastic online program called Teens Taking Charge. It's an online free program. It was developed for self-management for teens. There's a program, there's part of it for parents. It's accessible, I think, through aboutkidshealth.com. And it has information, self-management tips, things about transition.
And also transition from pediatrics
to adult care. So I think that is actually a lovely program. And we are trying to work on another program for younger kids. So I think hopefully that will start coming about. Otherwise, if you have a very young child, speak to your pediatric rheumatology team, to your nurse. Really reach out to them, because they will have resources or connection to resources to help.
Yeah, well, thank you for that. We'll make sure to link that below the interview so that people can find that resource easily.
So great.
Yeah, thank you so much for joining us today, Lori.